Hey there, today I'm going to talk through the three most commonly asked questions that people ask before coming into physio for their first appointment. Often they can be too busy to ask them as well, so this is just going to really help get you nice and prepared for that first appointment. So the first question that people often ask, and sometimes this is the same before they booked in as well, which is physio the right solution for my problem? If you're someone who struggles with neck pain, knee pain, back pain, and you want to get back to being active and you want to get some natural therapy which is going to help to soothe the discomfort, get rid of it, stop it from coming back, and all without having to see your doctor or without having to take any painkillers, then yes, physio is the right option for you. Physios and myself are trained specially to know exactly the workings of an injury and understand exactly how to get it better as well. So we're in the perfect place to get you better without having to rely on going to see the doctor for help, which often takes weeks and often just results in getting told to rest and to take painkillers. And the next most frequently asked question is how much pain will it cause? Now, the honest answer is very little. Some of the tests we do on that first assessment to diagnose your problem are basically what we call pain provocation tests. So it's where we need to stress certain structures to work out if they're driving the symptoms, basically. So me or one of the physios who you see will warn you and basically kind of talk you through exactly what to expect before doing any of those tests. And if you decide it's too sore together, you realise that the pain is actually really severe, then obviously we won't do those tests. All right. But generally, that first session is the only time we're going to cause any discomfort. The rest of the time, I've been specially trained to work with the body, not against it. So all of the treatments that we do will be designed to reduce but not increase symptoms at all. And unless you've had surgery, it's unlikely that we'll ever use the analogy no pain, no gain. The next most common question that we get asked is, how will physiotherapy help me? Now, one of the first things we'll do is talk you through on that first session exactly what's wrong, tell you how to get better, and just that alone, just knowing and understanding your problem will actually make you feel better. And having a professional there to kind of talk you through a plan of how to get you better, often people literally feel lighter, they feel better just knowing that they've got someone there to help them and that there's an actual light at the end of the tunnel. Then the course of treatment that we'll prescribe or recommend will involve some hands-on treatment initially to get you feeling better, to soothe muscle tension, to basically mobilise and get those stiff joints moving so that actually you feel more flexible, you feel more relaxed when you move, and actually you feel less pain moving around generally. Another real key aspect of physio is rehabilitation, which is where we use certain stretches and certain exercises to speed up your recovery basically. They get your body moving better, and they're the things that stop your pain from coming back as well. Coming from a background in sport, we're in the perfect place to prescribe those exercises for you, and they're not going to be like the ones you can see on YouTube where you just kind of, they're very non-specific, they'll be laser specific to your problem. And we can talk you through them, or we'll send you a diagram of exactly how to do those exercises as well. Now, I know I said I'd only do 3 questions, but there's a couple more which always come up as well. What should I wear to my first appointment? Girls, if you're getting your neck or shoulders or back assessed, wear a strappy top. Just makes it easier for us to see the shoulders and see any muscle imbalances, just to help us get your diagnosis right. And anyone who's getting anything assessed below the waist, then a pair of shorts really helps to just free up your movement so that we can kind of get everything moving freely without any restriction from clothing like jeans. Then if you're a runner as well, bring your trainers so we can have a look at those just to make sure that they're not part of your injury. And often with foot, knee or hip problems, we can often see that some of the issues stem from the shoe, so bring those in if you are a runner. Last few, can I bring someone in with me? Sometimes that can actually enhance the assessment, and often people can feel more relaxed, less worried about forgetting to ask questions. So absolutely, you're absolutely fine to do that. But for people who are a bit nervous and feel more comfortable, then I would actually encourage it.